for recognizing people who are making tremendous contributions to the work that we are studying and sharing today. It's time for our Community Leadership Awards, and Cathy O'Connor is going to join in the presentation.
We call for applications for Community Health and Equity Leadership Awards from across the state, and we received quite a few good ones, although I will encourage those that once you notice your region hasn't been called to next year, kind of garner yourselves together and recognize people from your region, because that's really very important. So we do have 4 awards that we're presenting. Okay, so the first award is from the Central Region, and it's for the Worcester Healthy Start Initiative. For 10 years, the Worcester Healthy Start Initiative has worked with the most vulnerable populations to ensure equity in birth outcomes. And the initiative, founded in the year 2000, was meant to address the rampant racial disparities in birth outcomes in Worcester, which I can attest to since I live in that area. At the time of its inception, the infant mortality rate for blacks in Worcester was more than 4 times higher than the whites. And today that gap has been cut in half. While Worcester Healthy Start is open to all women who receive prenatal care in Worcester, the program primarily targets high-risk, low-income women of color who live in Worcester to receive comprehensive prenatal services. The Worcester Healthy Start helps women from different cultures and language backgrounds to navigate the healthcare system and works with providers to ensure quality care to all women, regardless of their race, ethnicity, or their ability to pay. And I think it's Megan, right? So on behalf of the Worcester Healthy Start Initiative, Megan Young will receive the award. The next award is from the Northeast region, and it's for the Health Promotion Club at the Lawrence High School for Health and Human Service. Turning the challenge of health disparities in one of the poorest immigrant communities in the state into an opportunity to develop youth leadership and to celebrate one another, the Health Promotion Club of the High School for Health and Human Services in Lawrence provides exemplary leadership model for communities across the Commonwealth. The group has engaged students across Lawrence High School system, reached out to community members, extended its scope of efforts and partners to tackle pressing health issues and develop a cadre of youth leaders eager to pursue future careers in public health and health care. And we could really use them. We heard that this morning. The group promotes institutional transformation, ensuring that the high school not only teaches about health and human services in the abstract, but provides a learning environment that builds the skills and knowledge through service learning that addresses the very real health disparity issues in the lives of students and their families. And today, unfortunately, the young people had another engagement, so they weren't able to join us. But we hope to visit them, to celebrate with them. So on behalf of the Health Promotion Club, their coordinator, Diane DeVilla-Colon, will receive the award. I hear they have some really good videos. Are they on the internet? Yeah, so
Slideshare.net.
So I hear it's called slideshare.net. So when you go home, take a look.
So search for the Health Promotion.
Yeah, so search for the Health Promotion Club. You know, you have it in your book. So we'll see you a little up close and personal. The next award is from the Greater Boston region and is for Emily Shea, who works right now at the Action for Boston Community Development Elder Services. Emily Shea promotes health equity by addressing racial and ethnic disparities among the aging population. While most people hope to age in security and comfort, many seniors face a more somber reality. From 2006 to 2008, Emily's work centered on social policy as the executive director of the Boston Partnership for Older Adults. And in this capacity, Emily led a coalition of over 200 organizations and individuals that was funded through the Robert Wood Johnson's Community Partnerships for Older Adults initiatives. We always get really long names from initiatives. And they were working to improve and enhance the long-term care and supportive services for older adults. Emily is now the Director of Elder Services at the Action for Boston Community Development, fondly known as ABCD. That's why I'm struggling with trying to say the right words for it. Where she works to promote healthy communities and bring individualized services to low-income seniors in the city of Boston and the surrounding communities. In her role as director, Emily promotes among her staff the importance of equitable services to all members of the Boston community, especially our historically underserved aging population in communities of color. Congratulations, Emily. So I think Anita helped with that nomination. Thank you very much. And our last award, which I've tortured these two women all day by keeping telling them they were about to get their award, and they were so nice to me they should get like double. And they might. But then anyway, the next is from the Southeast region, Marsha Picard and Pat Bebo from Healthy City Fall River, the Children in Balance Project. Like many school systems struggling with diminishing budgets over the past decade, Fall River began to dismantle its health and physical education curriculum. The results were typical of communities across the nation who saw children spending less and less time in active play. When Fall River was selected in 2008 as one of the 3 communities in the country to replicate Tufts University Children in Balance obesity prevention program, the challenge was to find people who could not only adhere to the objectives of this major research project, but who could also make this groundbreaking approach work in Fall River, which I imagine was a challenge. Right? As project manager, Marsha Picard was the right person for the job. Not only had she recently retired from a long career in school health, so much for retirement, and as a physical education teacher and a stint working for the Girl Scouts, she was still looking for a challenge. Marsha quickly teamed up with Pat Bebo and her staff at the University of Mass Extension Nutrition Education Program, and together they began to make the improvements in Tufts' initial curriculum to better fit the needs of the Fall River school system. Pat brought an extensive background in nutrition and had worked tenaciously for several years to get her nutrition education staff into the school in Fall River. Pat quickly embraced the Tufts approach and had her staff leading exercise sessions in the classroom as part of their elementary school nutrition sessions. The children loved it. The teachers began to see the value of exercise in enhancing learning. Now the children in Fall River have the opportunity to learn important information about food they eat and get lots of support for making healthier choices thanks to this project and the work of Marsha. I'm always trying to get out of the picture.
Hanging off to the side is not going to work. A little closer to go. All right, that's good.
But can we give another round of applause to all of our...
Thank you very much, Cathy, and congratulations to all of you who won awards. Thank you also to those of you who nominated people, and congratulations to all the nominees. It was very difficult for the awards committee to make some of these selections. It's a fantastic community that we are part of, and there are a lot of people doing exemplary work.